Tonight, we honor those who keep our medical community running strong. The outstanding level of healthcare across our region would not be possible without its knowledgeable, passionate nurses. It's our hope that these awards can help recognize a field that will grow ever more important in the years to come. To help highlight these outstanding professionals, we asked a distinguished selection committee comprised of respected leaders from such organizations as the Mayo Clinic, Johns Hopkins University, the University of Missouri, the Missouri League for Nursing, the Get Well Network, and the Nurse Practitioner Healthcare Foundation to review the candidates. Together, they scored more than 200 nominations and helped select 64 finalists across 19 categories. These nurses represent a vast range of practice areas and levels of expertise, from emerging leaders to those with a lifetime of experience. They serve as inspiring examples to colleagues and to future generations of nurses. And most importantly, they make a lasting impact on the lives of patients and their families. For that, we say thank you.
Worked on a floor called the Transitional Care Unit. And what was great about that floor, it gave me a wide variety of patient population. I really kind of fell in love with the patients that underwent congenital heart surgery. Those patients tend to spend a little bit more time in the hospital, so you really get to have a bond with the families and the patient.
What's most striking about Michael is his compassion that he shows toward his patients. And the response he gets back from that he is completely a patient advocate. He gains the patient's trust and completes confidence in him, which I think is probably one of the most important aspects of anyone in the medical field, and Michael exemplifies that.
I work with an amazing team, I really do. You know, it's just not me doing the work. I work with so many nurse practitioners, physicians, and we really have a strong bond. The advice I would give to a new nurse is to really be present. You know, today we're in this social media society. We're trying to get our work done, see our patients, get our vital signs charted, get our documentation done. But really just be present, keep your ears open, listen to the family and the child, you know, what their needs are for the day, and really ask lots and lots of questions. You know, you want to fill yourself with as much knowledge as possible.
Michael is really an essential part of pediatric cardiology team here at Carnegie London Children's Hospital. The whole entire hospital know that.
When I started in the intensive care unit, there were no intensivists, there were no hospitalists. The RNs were the ones who functioned as the physicians because the surgeons were in the OR.
Stephanie is the most amazing nurse practitioner that there is. She's able to meld beautifully both the empathy, the sympathy, the care of what the patient is going through with an extraordinary fund of clinical knowledge.
My job is a hybrid position in the fact that I work both in the hospital and in the office. So I round in the morning with our physicians. I get to see all the sickest of the sick in the hospital, take care of them, and then in the afternoon I come over to the office and I do the hospital follow-ups. So it's a real nice mix for me, and that's one of the things I like the most about my job.
She has recognized a heart attack with changes on an EKG not noticed by anybody else on the team. I've also seen Stephanie when patients don't do well. She's out there crying with the families. Her knowledge base, how she deals with patients, is something that is so valuable that if even a small percentage of what she does can be passed on to the next generation, it's invaluable.
Pediatric neurology is a specialty that often involves very complex medical disorders that can be very stressful to patients and their families. For example, epilepsy, autism, various brain injuries. Ashley has really touched the lives of many different patients and families in providing them with excellent care, support, and education.
I think some of the most rewarding things I get out of my job is definitely the bonds that I've grown over the last few years with my patients and their families. These families are dealing with such difficult things on a daily basis, and to see how they overcome those obstacles is encouraging. These patients and families have made me have a different outlook in life. They've shaped me to be a better person, a better mom, and definitely a better nurse.
Ashley has this really special knack of relating to people in a very approachable, personalized manner. And regardless of the situation, she always inspires hope, compassion, and confidence in the patients and their families.
As my career has grown, Dr. Wong has given me a great opportunity that I now do 50% clinical nursing and 50% research. So being a part of that full circle of care, I find very rewarding. I would advise new nurses to never stop asking questions. The medical field is continually growing, so the more questions you ask, the more knowledge you gain, and I think that makes you a well-rounded nurse.
I was born when my sister was a teenager, so she was a nurse when I was a little girl, and she is still a pediatric nurse practitioner, and she's my hero.
If you saw Robin walking down the hall, you would not know that she's the chief nurse officer of this hospital. She carries herself with a smile. She greets everyone that she comes along, and she never not stops to speak and say hello to someone.
I once had a family who their father was passing away, and so they wanted to bring his bird in. And I said, oh my gosh, sure, bring his bird in. Well, his bird was like a eagle. It was like this huge bird that squawked so loud. The whole hospital knew what I had done, but this patient passed away that evening. So he got to spend an hour with his bird. So people don't let me forget about that. I would say that part of the reason that I'm in this administrative job is because I love nursing. People will say, oh, she's a nurse's nurse, and I really like that. I love that they say that. I still do patient care twice a week. I still put on scrubs. I still go out, do the turn team with people. I think when they see that their administrative leader is a nurse at heart, they just follow suit. So I think everywhere I've gone, I hope that I've inspired people to realize that nursing, yes, is clinical, but it really is that care, compassion, above, beyond, those simple little things that really drive nursing.
Ashley is passionate. She is excited every day to come in and take care of patients. Always, positive, upbeat, and an excellent clinician.
I've been a nurse for, it'll be 4 years, I guess, in the fall. But the biggest challenge is obviously it's a emotional, physical job. It's draining in a lot of different ways. By helping people and everything, it's a lot. You get attached.
For such a young person to have a deep understanding of the emotions that families and patients are going through with those decisions, because we get those patients probably more frequently than the average unit does. Being a neuro step down, our patients will come in with life-altering events, and her compassion to them is pretty impressive for her young age.
It can be hard to balance, one side of medicine with having to, the science of it, and then having to also be compassionate. Definitely a struggle, but I think that, using your resources, using your other nurses that kind of help you, they can really help you balance it.
She's a fantastic problem solver, and then she shares that knowledge with her staff. Ashley is a natural-born leader. She has the ability just to set an example and lead by her actions. That's who she is.
The first 20 years of my nursing career was on a trauma neurosurgery floor.
Susan used to be on a neurosurgery trauma floor, and so she was in charge of one crisis after another. Now that she's in the outpatient setting, there are still crises, but they tend to be a different type. Susan's very important to the future of nursing. She leads by example, and she's able to teach. She's very well-rounded and very experienced.
I've now been outpatient at internal medicine at SLU Care for 20 years now. I'm glad to say that I think I have the respect of most of my coworkers, the physicians, but the patients also. I mean, they know me, and I think they trust me, and they ask for me, and it's really a wonderful feeling.
Started out as a paramedic, realized I love spending more time with my patients, so I decided nursing was where I belong.
Our patients in the CTICU oftentimes are very, very sick and require advanced level of knowledge and advanced level of awareness. Josh is excellent support, not only for fellow staff, but for the patients and for families. He is a hard worker, emotionally and physically. He puts the extra time and he puts the extra effort in. He makes sure that, when he passes on a report, that I'm aware of small details that could make a difference.
I lead by example. You help out when help is needed, always stepping up to the plate, don't ever back down. I sit on the preceptor committee, I teach ACLS, I teach BLS. My master's is in quality improvement informatics and leadership, so you're always trying to make the workplace a better environment for your patients and your coworkers.
He does the whole job, and he's willing to help the person next to him, or if somebody's struggling, or he'll help pick up the slack when he can, and that's so necessary in an environment like this. Nobody does it by themselves.
The small difference I get to make in a patient's life is the most rewarding thing. It means the world.
I like the psychosocial part of nursing and those dynamics. And I feel like if we can't fix the patient or we can't get them better, then they still require care. It's just the kind of care changes.
I think Erin is not just good at what she does, I think she's excellent at what she does, because she is what I would call the total package with a palliative care nurse. She seeks information from the patient, wants to know their story, what's going on with you, what's important to you, what are your goals in life, and she helps to develop with the entire interdisciplinary team what the plan of care is going to be for this patient.
So part of taking care of patients in the area of palliative care, it's not just the patients, it's their families, it's their loved ones, it's their friends, it's their significant others. And this is intense work, and it is not easy work. But to be mindful of the fact that it's really all about the patient, and can you find just even one thing in the course of your day for each of your patients that's going to make that patient's day a little better? I think that's a little takeaway for younger nurses, and also to find the area of nursing that you're passionate about, because it is a profession that allows for a lot of flexibility and ways to reinvent yourself.
I am one of 12 children. I'm the sixth child, the second girl. And you worked. You had responsibilities. It was just expected. I think some of those characteristics are things that I still rely on today.
Working for Cheryl has been a privilege for me. She has taught me a lot in the short time that I've been under her.
So I'm responsible for 5 departments: surgery, endoscopy, the recovery room, ambulatory surgery, and sterile processing. And I would say probably anywhere from 180 to 200 FTEs.
I believe Cheryl goes above and beyond every day. She is extremely caring. She has sat with families in the best of times and some in the absolute worst of times.
I do think I'm a fair leader. My expectations are really high for my team, but they're no different than the expectations I put on myself. I will get right inside any department that I have the responsibility for and work side by side with those leaders, and they know that.
I have an amazing boss, and I'm proud to work under her.
Children are definitely an exception to the rule of healthcare. Everyone thinks of healthcare as like a sad, hopeless kind of industry that we go into, and you walk into a children's hospital and it is bright and it is loud.
Maria has stood out to me as one of the nurses that is able to form a really special relationship with her patients and the families. She is set apart from other nurses because she has just a really huge heart.
Little kids get knocked down time and time again, and you will walk into the room 2 hours later and they're up playing and laughing and running, and you think, man, this kid is so sick, and you never know. We've had kids here for 6 months to a year that were supposed to come in for simple asthma or blood transfusion, and it just spiraled into so much more. There are lots of challenges that we see all the time. I don't think I would still be here today without the team that I work with.
She's also endeavored to going on medical mission trips to Honduras, and she has encouraged other nurses on the floor to go with her, and she's done that 2 years now in a row and has come back with some really great experiences and have been able to use those experiences to make sure that they give great patient care here to the children.
You aren't here to fix everything that comes your way, but you're here to strive to be a brighter part of their darker hours.